We're very pleased to see all of you choose to spend the next hour or so with us. The topic that we have is feedback, right? So how you give feedback, what words you use, that can actually be a significant influence on what's received and how students use it, right? So how we're going to go over the next hour, we've got a few things we wanted to touch on, and we'll start with the basics of why, like why even give feedback. We'll look at some of the publications, a couple of the publications especially, and some key messages from those publications about feedback. There's quite a bit of research in that area, and we'll point out a couple of things that we found and we think you might be interested in. We'll look at the student perspective, right? So, here we're all preceptors, but how does that look from a student lens, right? And where are those opportunities that we can capitalize on? So Janet's going to talk about things like extrinsic factors, intrinsic factors, and how all that affects how feedback is given and received. Okay. Now, even though you might have the best intentions, sometimes things don't go the way you expect it to, right? So things go wrong. So we'll touch on a few things, things that you might be used to doing quite frequently, and maybe may not be the best approach. So we'll touch on a few of those, and we'll talk about a concept or a model of communication called advocacy inquiry. And we'll do some practice around that, okay? So you get to actually practice some things here. And with that, I'll hand over to Janet.
Great. Thank you. Oh. Can you hear? No, I didn't know if I had this on. Can everybody hear me? Good. Thank you again for coming to the session about feedback and how your words matter. So again, just even from this simple family cartoon, it's if we were giving positive feedback all the time, we wouldn't need this discussion, right? There are times when we have to really dig into situations. So that's what we're going to talk about, is how your words will be used in a positive manner. So some of the goals of feedback, and I don't want to spend a lot of time on this because we've already talked a lot about feedback in the past. We want to see a positive change in the student. So again, how are our words going to make that effect? We want it to have a long-term effect. So we're building a foundation for our students, and as you may have heard, these are people that you may be working with in the future. So these are future colleagues. We want to have a nice foundation and work with them in a respectful way. And ability to meet future changes. So again, this is something key as we learn, is that we are going to be able to apply the feedback that we get and use it as a foundation, but also moving forward and to set new goals for ourselves and actually to become self-motivators. So as preceptors, and your value is so key as a motivator, but it's also establishing a self-motivation within your student. And I'm not going to go a lot into the evidence. There's some really good teaching articles out there. Now, John Hattie, who made the first comment about the importance of feedback and the powerful influence it has, is a key educator, has done a lot of studies on it. And it's really interesting, among all the factors that influence learning, our teachers and the way they give the feedback. So it's a huge influence that we have on people. And I do recommend John Hattie. He does have a lot of studies. It's really backed up to what he says. And the other important thing is that we want them to use these skills in the real world. So it's something that, despite all the research and everything, these are real people using these skills in the real world. I'm not going to go into a lot of this. Again, you've seen it before. The most important thing is that it's timely. And they all go into the effectiveness and the quality. So when it's timely, it's specific. You can actually bring up key components of what happened. And it's something that usually happens on a verbal basis. So as preceptors, you do this quite regularly. It becomes quite natural. So now we want to find a new natural way of discussing in some of the more complicated situations. We want to make sure that it, again, follows all the criteria, that it's ongoing, it's goal-oriented, doesn't include judgment. It's something that the student can use and have an action. Very specific, but most of all, even motivating. So the student feels like, wow, I've really learned something. Don't be afraid of this slide. There's a lot of information here. And again, this is just going into understanding the student. And Colleen, our keynote speaker actually talked a lot about components of this. So looking at environmental, we've all heard this before. It's frequent. We give small bites of information to our student, and again, those words do matter. The timing and the place. Place becomes critical when it's a serious situation, and being healthcare workers, this does happen when you're working with students in a lot of different areas. The author of this article, Wilkinson, is actually quite interesting. I found this article particularly interesting because he's actually in pharmacy. He works with residents in a residency program. So he did a massive study on research and finding what actually forms the residents, and how he actually surveyed not only preceptors, but surveyed the residents and their experience. So again, it's really key when you actually find somebody that's using healthcare criteria. The most important one that he actually mentioned was the interpersonal, which was really huge. It really ties into what Colleen had said this morning, because we don't really know what's going on in our head and in the student's head. Hopefully we know what's going on in our head. But again, it's one of those situations where you want to give the most useful feedback, but you have to understand that there are different communication types, that they have different learning styles, which we dug into really deeply today. So there's a really good understanding of where your student may be coming from, and different personality types. So not just the student, but you yourself. And you can actually think back to some of those times where you may have had a really good rapport with somebody versus a situation where you may not have had such a good experience. And the situational ones, again, this is nothing new. It's always easier to give positive feedback than it is negative. And again, Wilkinson did mention that it was 91% was easier to give positive feedback than negative. So he actually did mention the Oreo cookie or the sandwich feedback, or there's a lot of different techniques you want to call it. But again, he said that that was really useful and positive to the student. And of course, we always want to make sure that it's specific to a specific situation and a specific type of action that the student may have had. We want them to actually see that performance enhanced. So looking at the sandwich, and what makes this really key in some of those situations is that it maintains the attention. So now you're giving something really positive, and I think we mentioned it's even in our breakout session, that you want to give that little bit of positive first. What they did, oh, I like the way you introduced yourself to the patient, even though they didn't speak English well, you did a nice job. And then you can give them the meat of the feedback, and then give them something good again. So again, it makes them more relaxed, makes them feel comfortable, and it actually develops a little bit of a rapport, and you want to build that trust with your students. So now you're starting to trust each other, and they know, importantly, that they can trust you. And then the sources. Again, this isn't something new. The verbal, of course, is mainly what we're going to be talking about here, because this is one-on-one, it's at the time, and it really does have a huge impact on students. With the written, it would be either online or in a form, really important for documentation. So that part is important. It can be delivered from different people. So as preceptors, really key to make sure that you're giving really useful information. But also when we look at it from a SAID perspective, we're looking at the student as a broad practicum experience. And of course, feedback is going to vary from site to site. So your student may actually comment that they've actually experience something differently. So again, there's tools to make them understand that this is a new experience. And again, don't be afraid of this slide. When I think of a student that's facing me, I always think of when I learned to play golf. It makes you feel uncomfortable, right? And we always tell students to get out of your comfort zone, but that may be easier said than done with some of all those intrinsic factors that they're coming to you with. So when I think of golf, I did feel uncomfortable and definitely awkward. Even now, there are times where, I could always be better. But we don't want them to get to the blundering, inept feelings or incompetent, because at that point, it really becomes difficult to motivate them. So we're here on that middle level to draw out and motivate their knowledge base. So what do they really know? How are we going to help them? But how are they going to help themselves? Make them eager to learn. This is fun. I love what we're doing here. So again, it's something that really gets them going and open to ideas. So we want them to look at this experience, even though you came from a hospital, now we're in the clinic, we're going to do things a little differently and just be, polite and respectful, understand they had an experience or never an experience at all, but give them something to work with. And the desired outcome, we want them, even though they may not be a master in their field, we want them to feel comfortable. We want them to be proficient to a certain degree and to feel they can actually reflect on the goals that they actually achieved at your site and that you're responsible for that. And this was really cool. So last year, at the end of Practicum, we had the students give us their biggest lessons. And it was about making mistakes. So when you read it, the biggest lessons have come from my mistakes. And that's really cool because we allow them to get that experience and to feel uncomfortable and to learn. And when I think back, I'm going a long way back, when I think to when I was a student and first in medicine, mistakes still happened. But really, we didn't use it as a learning tool. So when I think back to some of those times, learning was more just from the book or from the preceptor, but when a mistake was made, we never really talked about it. We made it right, we went forward. But in medicine, and I can remember this was in the 80s and the 90s, we actually came out with evaluating the mistakes that were made, coming out and discussing it. And I remember one radiologist had actually used that with his residents, and it was a tool, I think, in the 80s that he came out with, is that we have that transparency with our patients, with their families, and it wasn't something that was really discussed. And then we had the near misses that came out, because this hasn't always been around, so near misses were fairly new as well. So again, it's one of those tools now that we use as mistakes, and it's okay to get into that uncomfortable feeling. You're going to bumble around a little bit, but it's okay. We want to grow from that mistake. We want to evaluate it. And as preceptors, we make that situation comfortable for them, that they're allowed to make that learning process. And this just goes, again, to it's the teamwork that's involved. So this was a student that actually just, what was your biggest lesson? Well, I loved the teamwork that we had as a group. So again, you've done a wonderful job in seeing students as part of your team and making sure that they feel comfortable to get out of that zone where they're learning. And one of the things about feeling uncomfortable is that you actually have focus. So when you're feeling comfortable, the focus tends to drift, but that uncomfortable feeling is hyper-focus. And even when I think of those golf lessons, I'm really focused. I really want to get a good driving distance. So again, it's those things that you're going to apply your focus to. So again, from a student perspective, it's giving them that comfort that they can take the opportunity to try and make mistakes on occasion. And again, we've talked about it before. We don't want to see feedback as criticism, and that they understand this is a great learning opportunity, and there's different entrance points that we can use, and not to focus on the negative, to use it as a positive. And you will find students do that. Even though they're given the feedback sandwich, they still focus on the negative component. So again, it's transforming those roadblocks, understanding where the student may have a roadblock, asking them, and we're going to give you some tools, and look at these as an opportunity for growth. You're going to note when they actually used feedback and how it was implemented, that they were able to establish new goals from the feedback, and that they actually seek it. So again, that's one of the new growths that you see, and I love that when I see that, and students are actually learning, okay, how can I make this even better than I had it? Okay.
Okay, so say you listened to everything that Janet had to say, and you tried it, right? Sometimes, not very rarely, I think, things don't go well. So let me show you a video that illustrates that concept, okay?
So that was my weekend, nothing special. What about you? You seem rather chipper for a Monday.
Today is a good day. It's my performance review.
Wait a minute. You're excited about the performance review?
My next meeting is a one-on-one. I have to deliver a performance review.
That's not necessarily a bad thing.
It's with Matt.
Oh, I can see why you're so depressed.
Man, I'm stoked about this one. Because last time Melanie gave me kind of a bad review.
Last time I gave him an extremely negative review.
What exactly did she say?
You know, mumbo-jumbo manager speak.
I couldn't have been more clear.
Like needing a little touch-up here and there.
His appearance was sloppy, he was passive and unmotivated.
Maybe learn some more stuff.
And the quality of his work was completely substandard.
And we talked about my future.
I also said that I didn't see much of a future for him.
Dude, you have to read between the lines, but she was majorly hinting that I could go places.
I don't think he's gonna make it to the end of the year anyway.
With a little spit and polish, no big deal. So that's what I did. Got myself some spit and polish. Buddy, you're looking at Mr. Improved.
If anything, he's gotten worse. I don't know which is more objectionable, his social deficiencies or his technical incompetencies.
I mean, I busted my hump this last year. I even took some night classes at the community college.
I can see why you're so enthused about things.
It's more than that. I think I'll finally get that promotion I deserve. And believe me, with a new baby on the way, I could use all the cash I could get.
I'm putting Matt on probation, and that means no yearly bonus, but fortunately I hear his wife has a good job.
Especially with my wife losing her job and all.
Sorry to hear about that, mate. Tell you what, you give me a call after the review and we'll celebrate over lunch or something.
Yay.
Okay.
Cheerio.
Well, call me for lunch later. I have a feeling you're gonna need to take a break.
Well, Matt, are you ready?
You bet. Now, I'm jumping the gun a little bit here, I know. And maybe it's just nerves because my wife lost her job and all. But you'll see I deserve that promotion.
Promotion?
Yes. And I have you to thank. You know that little pep talk last time? And with being a new daddy and all. Anyway, I'm just so excited to hear what you have to say.
Facing a crucial conversation? Vital Smarts can help.
One of the things that we want to talk about is advice. Now, advice is something that we commonly use. I use all the time, right? And the point here is that advice on its own may leave some things to be desired, right? Advice on its own may not have anything constructive that the student can work with. So if you tell them, you know, this is how you do it, they might be wondering why, right? So if you go straight to advice without, you know, structuring a lot of feedback around it, it may not be as useful as you think, right? Another problem with advice on its own is that students might start to rely on it, right? So if they come into a situation and you tell them what to do in that situation, then they might start to expect that every time they get into that situation. They become reliant on that advice, and the next time, if they get in the same situation with another preceptor and they have slightly different advice, this can actually cause conflict, right? Because they're hearing two different things, and they're not, you know, really reasoning it out themselves, right? So what we could suggest that you might consider is to let the learner come up to their own conclusions, okay? Let them think about it themselves before you give them the answer or tell them how to do it, right? This kind of fosters their critical thinking, because a lot of the professions we work in health sciences, you have critical thinking as a component, key component of how we work, right, in most of our disciplines. So if we're able to foster that, this is one way to do it, where you're not actually giving advice, you're just letting them come up with the answers. It may be wrong, but there's learning in that itself, right? It lets you figure out their mental maps, and then based on that will decide how you proceed or what you dig into more. So that's the concept here about advice, okay? With preceptors, many times I'm guilty of this too, is that's one of the first things we jump to, right? So I might say, if I were you, I would do this, right? You go straight to that, but if you can hold back a little bit and let the student think about it themselves, usually leads to better outcomes and better rounded growth for the students, right? That's the concept here. Now, another piece that you might want to think about is judgment, okay? So how many people have said, good job, you did well? Is that wrong? What do you think? How many people feel saying good job is a bad thing? There's one, maybe 3, 4. Okay, not many, okay? And I kind of agree with you. I don't think it's a bad thing. What the challenge is when that's all they get, okay? So if it's just that, then that becomes a challenge because they're not getting the constructive piece with it, right? So they need to know, okay, what specifically did I do well, right? What did I not do well, okay? And And then we want to elicit some of that, thinking around that from the student, okay? So the other piece that's with judgment is that it's telling you, or telling the student, how much value you place on a certain attitude or skill or activity, right? And the next time somebody else has a similar judgment, they might be judging that differently. They might put a different value on what the same thing that the student did. So then again, this becomes inconsistent and can lead to some conflict within the student, right? So again, no problem saying those things as long as you back it up with some solid, constructive, actionable feedback. Okay, so that's the message here. Now, we're going to do a test. Okay, so were you guys ready for a quiz? I guess
Gets the
not.
blood circulating before lunchtime.
Yeah, work up your appetites. Okay, so Janet's going to explain what we're going to do here.
So we're going to go over some scenarios, and you're going to decide whether the comment is either judgment, so you can put your hands on your hips, it's advice, or is it feedback? So again, it's one of those things, you can do it in your seat or you can stand if you feel like you need to stand up. It's one of those things that we want to just test your ability to kind of decipher. And these are words that I've used. I still use them. So again, it's something that we want you to be more aware of the words that you use in specific situations.
Yeah. So like we were saying, this is a good way to work up your appetite before lunch. Okay, so that's the goal here. All right. So first one. Rounds today was better than yesterday. You made it clear why we made the changes we did. There was still a challenge with the lack of descriptive charting, though. So would you say that's feedback, judgment, or advice? We see a lot of feedback.
A lot of arms in the air.
Yeah. Okay, yeah, I think we agree. Okay, so definitely feedback, right? So you've got some constructive information there that the student can actually use, right? It's very specific and actionable, which is great. Okay, how about this one? You need to wash your hands before you put your gloves on. How about that one? I see a lot of advice. Yeah. Okay. Has anyone said that by chance? Or something similar along those lines? I have. Okay, well, you guys are much better than me then, okay? Okay, so yeah, this is advice, which sometimes we jump to, but it's certainly something you want to try and limit and make it more around feedback. So here's another one. You did well with that blood draw. What do you think that is? Yeah, so a little bit of confusion here. So you did well, right? So that's the value you're placing on that particular skill, right? So you're judging that they did that well, right? Okay? You're not telling them what to do, right? So this is not advice, this is judgment, right? And again, is this a bad thing? Like, is it bad to tell somebody that they did well? Not necessarily, right? As long as you tell, you did well with that blood draw, you identified your patient well, right? I'm sorry, I'm not an MLT person here, but the venipuncture was excellent. You drew the right amount of blood. I'm just drawing things out here. Forgive me if I'm wrong with this. But yeah, so if you go very specific about what they actually did, that becomes much more meaningful, right, to a student. Okay, so that's that one. Let's do another one. Your presentation in rounds today was weak. Yeah, judgment, hey? Right. So certainly, a lot more could come from that statement, right? And this is really not much useful to the student. Okay, was I not speaking loud enough, right? Was it that the information I gave was not what was expected, right? Did I speak out of turn? Like, what was wrong, right? That's what the student's wondering, okay? Okay, here's another one. You should have checked the name band to correctly identify your patient. Advice. Yeah, I think we're getting the picture here, okay? Advice. That's advice, right? Because you're actually telling the student what to do. You should have checked the name band, right? So that's the idea here. So you can see how sometimes this is not as straightforward as you think, right? It takes a bit of practice to trying to tease these out, okay? Here's the last one. Good work with that patient interaction. your explanation was effective, and you got the best results from the patient? Oh, feedback. Yes. Sorry, I tried to raise my voice, it didn't work. Okay. So good work with that patient interaction. That particular piece, right, is judgment, but then there's solid feedback along with it, which is really, the key there, okay? So good job. I think we've all earned lunch, sorry, okay? So we'll go on to the next topic here. Now, I want to know how, like, am I preaching to the choir here? How many people use advocacy inquiry? How many people have heard of advocacy inquiry? Okay, I'm talking to the right group. Good. So you might have heard of it. Maybe you just didn't want to put your hands up. That's all right. So advocacy inquiry is a model. It's just a way to communicate. Okay, and it's one where you hold your influence. You try not to influence, but you try and learn first. Okay, and we're actually going to practice this in the next slide. I'll show you exactly what it means. Or one way to approach it, okay? So, but the idea here is that you think of yourself as a detective, okay? Pardon me, EMS does this? Excellent, okay, yeah, EMS. Okay, so this is something where you're trying to not influence what the student's gonna do or think. You're trying to get it out from them, okay? And you're trying, like I said, you're trying to be a detective. You're trying to tease all those pieces of information out, okay? So the process, what you actually do is just a 3-step process. And there's several ways to approach this. This is one way. So the first step is you just state what you saw. State the observed behavior, okay? So for example, you might say, I'm concerned that you didn't check that patient's armband, okay? So that's your observation. You just say that, okay? Second step, you advocate your point of view, okay? So you might say something like, I'm worried that we might have done the procedure on the wrong patient. Okay? So that's your point of view, right? So that's second step. Third step is you try and tease out the student's perspective. Okay? So you might say, what was going through your mind? And then the most important piece is the fourth step, which is not on here, which is you stay silent. You stop. Don't say anything, let the student speak, okay? Because if you start to say, okay, you got to check your armband, you got to check the patient's armband because you might get the wrong patient, and then you might, treat the wrong patient, or you might do an X-ray on the wrong patient. You're going back into that advice piece, right? You're not sure where the student missed that. So the student might say, okay, well, I saw the patient's name on the chart that was on the bed, right? Or they might say, I heard the porter talk to the patient while they wheeled him in by name, so I know. Or, this is a patient that I had yesterday, so I've met this patient already, I know them, right? Right or wrong, you might not know where the student's coming from. You probably won't, unless you give them the opportunity to express it, right? So this is an idea or a way to communicate. Now, this would not work in all situations. Like, for example, if it's written feedback on DSL or COM tracker or forms that you're filling out, maybe this might not work in that situation. But if you have the opportunity for one-on-one time with your student, this might be a really good way to approach certain situations. Okay, so remember how Janet was saying most people tend to like to give positive feedback and try and shy away from negative feedback. You could use this approach as well, because you're letting the student tell you what went wrong, okay, or why they did whatever they did the way they did, right? So it takes a little bit of, you become less of the bad guy, right? Students are kind of bringing it out themselves, which is really where the learning happens, right? When they're thinking it through, okay? So that's the model now. Now we're going to get to practice, okay? We've handed it out, excellent. So at your tables, you will have a sheet that has a scenario. So we've got 4 scenarios, and each of your tables will have them. What we'd like to do is over the next 10 minutes, at your tables, just read that scenario and think about how you would talk to that student, how you would approach it. I'm going to bring up the other slide here. Try and use this approach. Jen has a mic back there, okay? So she'll go around to your table. If one person from the table could tell us how you thought would be a good way to talk to the student about this. Okay, doesn't have to be right or wrong, just want to hear some thoughts.
We had a couple different points here. First, we wanted to know whether if we could ask her why, or if it was work, or if it was something personal, if there was something else going on behind the scenes. And just to kind of open the door for her to come forward and talk and see what the reasoning was. Asking her if there was a better way that we can go about providing her feedback that doesn't bring her to tears, and also trying to enforce that the feedback isn't necessarily a bad thing, that we're just trying to help her get to where she needs to be.
Great, thank you. The other table, just want to see if there were some additional thoughts about this particular scenario. I know there was more, yeah, that side.
I think that we also would want to start off on the foot just by stating that we feel that our feedback perhaps may be having a distressing effect on them, and just that, yeah, along similar lines of just trying to let them know that they're in a comfortable place and try not to pressure them to feel like they have to tell us exactly what it is, just that if it's something within our means to fix, like maybe we just need to rephrase our feedback in a certain way or something like that. But yeah, pretty similar to theirs.
Okay, great. Well, thank you. Those are really good thoughts, right? Now, I'd love to know if somebody tried the advocacy inquiry approach. If you were using this approach, what would you say? Okay, so somebody on this side had the scenario, right?
I noticed you looked upset after our feedback sessions, and I'm concerned. Can you tell me what was going through your mind during our discussion?
Oh, awesome. Yeah, thank you. Yeah. Great.
Key things that you had mentioned before when we were discussing this scenario is that little bit of quiet that you give this student and give them a chance to talk a little bit if there is an issue. And again, we don't really want to get into personal things if that's not, again, that might escalate a little differently than we want it to. But again, it gives that, that little bit of silence, again, allowing the student to have their say. And that's hard for us as preceptors. Even, as a speaker, I want to do all the talking. I want to keep talking, and because I'm a teacher. So again, it's one of those things that's really hard to take a step back and just give them a moment.
Mm-hmm. Great.
Can I bring up one other point when we just talk about that? Hopefully I'm not jumping ahead too much, is the counseling services at SAIT. So there is, if you do have a student who is struggling, SAIT does offer counseling services for the students even when they're out in practicum. Sometimes they do have to come back to SAIT, or it can be done on the phone, but it's just something for you to be aware of.
And you can certainly contact your SAIT liaison and they can set that up. So thank you. Here's number 2. So for those who didn't get that scenario, we'll let you read it. So I love this one. So now, before we get into the advocacy inquiry model, what could the preceptor be thinking? So we got a few there.
Okay, guys.
Okay.
What do you
think?
think?
Yeah, what could the preceptor be thinking?
There you go.
The preceptor could be thinking that the student doesn't actually care, that they're not really ready for the placement.
Yeah, very valid. Yeah. Any other thoughts? What could the preceptor be thinking? Terribly disorganized over here. Okay, good.
We had 3 different thoughts on what the preceptor could be thinking. One was that the student was really late. Why weren't they here ready to go? We also had another that thought, you're great. You're 2 minutes ahead of time. We go at 7. You're going to be ready to go at 7. And that's great. And then we also had another thought that said, I kind of wanted you here earlier. I wish I would have communicated that I need you to be here 15 minutes or whatever before 7.
So true. We're making some assumptions here, right? So I mean, this is not the whole picture, but yeah, we're wondering, like, okay, is this something that I didn't communicate to you? The preceptor didn't communicate to the students? Is this something from the student side that's going on? They're not aware that they need to be here early? Is something else going on that they meant to be early and didn't happen for some reason, right? So there's quite a few things here. So I think you've touched on, we were going to ask what the student was thinking, but that could be some of the things that the student was thinking, right? Now, again, going back to the advocacy inquiry approach, how could you talk to the student about this if you're using that approach?
In the advocacy inquiry mode, I would just say, I saw that you came in 2 minutes to start. I'm worried that we didn't have time to go over the plan. Now, are you thinking, if this is your first day, what are you thinking?
Great. Thank you. Yeah, that's exactly what we're trying to get here, right? So letting the student come out with their reasons. You state your concern, but let them tell you why they came to, why they did what they did, right? And then you learn from that. Okay, scenario number 3.
So for us, the first thing was that we probably wouldn't let it continue for 2 weeks, first of all. But in this situation, our main thought was just to try to find out why the student wasn't wanting to take that initiative. And looking at our words too, and trying to make sure that we weren't, the wording that we were, it says, would you like to do this? And so sometimes students need to be pushed, and so to just kind of say, okay, go for it, we'll be there to support you, we'll be right behind you, but you're going to do this one. And just kind of push them into it a little bit and see how they respond to that.
Yeah, well said. I think that's a good takeaway, is that sometimes just saying, okay, here's the case, it's yours, I'm here if you need me, and just letting them go on their own, but knowing that you're there as a support. That might be a great way to approach this, right? Any other thoughts on that scenario 3? Oh, we've got one here.
I'm coming to you next, Amy.
Oh.
We had a few ideas of suggestions we could give the students if they were able to tell us what was making them uncomfortable. One could be that we could ask them what their goals are, because maybe our goal is for them to be doing stuff independently, but their goal is to be, a lesser role. We could also offer to do a simulation with them of the procedure, or we could tell them and kind of set an expectation with them for going forward. Say that the next time we do this procedure, you and I will do it together, and then the one after that, I want you to try it on your own, so they know what we want them to do.
Beautiful. Yeah, that's well said. Goals, a discussion of goals, right? What is the student's goal, right? And how does that align with what you might have as goals? And bringing that out from the student might be a great strategy, yeah.
Ours sort of preceded her explanation, which is find out what the problem is in the first place. Is it a lack of technical skills or their own perceived lack of technical skills? Is it shyness or maybe intimidation by the techs? Are they afraid of the equipment, or even just say a language barrier? This patient doesn't speak English and I have no idea what to do.
Thank you. So some great ideas, right? And some realistic scenarios, hopefully, that you got. Okay, here's scenario number 4. I'll let you read it. So again, anybody had this situation? Okay. All right. So again, all of these situations came from actual practicum experiences. Okay, so these are actual real stuff, right? Okay, so how would you approach this one? If you're using the advocacy inquiry model, how could you approach this one? And then we'll talk about your thoughts as well in a situation like this.
You could say to the student, I noticed when I am providing you with feedback that you often try to explain why you did what you did, and I'm concerned or worried that you are not hearing the constructive feedback that I'm saying to you. Can you share your thoughts on this? Beautiful. Beautiful. Okay. Now, let's also just get a little bit of information about what do you think in this kind of situation? What's going on? Who else had that scenario before? Okay.
We were just thinking about the fact that there was obviously some relational disconnect, and so that would be something that we would have to kind of work on so that she could open up and in a trust relationship and feel that she was in a learning environment.
Great, thank you.
Hi, so this kind of scenario, I would explain it to the student very politely that I know you're very knowledgeable with lots of skills, but you have to follow our standards with correct policies and procedures.
Great, thank you. So Thanks so much. I think these are great ideas. Another thing that you might talk about in this situation is try and build on their own skills. So life experiences that the student has had, see if you can leverage that to whatever situation's happening, right? We'll leave you with this thought, okay? Thank you so much for participating and for taking the learning. Thank you for being preceptors. It's greatly appreciated by the students. You make a big difference in how they learn and what they go home with. Okay, so thank you.
I just want to add one more thing, is again to use the SAIT instructors to help you out in some of these situations. If it's something, and I know as preceptors, we may not be working 5 days in a row with a student, or again, approach your site liaison if that's something in your discipline. But again, always contact a SAIT instructor if there's something that you're not really sure of, or you really want a little bit of advice, or a little bit of help, or a little bit of work with a student. So again, we're always here to support you. Preceptors do a fantastic job. Your words matter, and we can actually see that in the results we get from our students. So thanks again.